If you were prescribed GoLYTEly, NuLYTEly, TRILYTE, or COLYTE for your colonoscopy, this video will walk you through exactly how to take it. These preparations contain polyethylene glycol and electrolytes and are taken in two separate parts. I'm Dr. Francis Horenstein, a gastroenterologist at DigestWell Health. Pick up your bowel preparation from the pharmacy at least 5 days before your colonoscopy. The day before your procedure, do not eat any solid food. Drink only clear liquids throughout the entire day. Try to drink at least 8 ounces of clear liquid every hour after you wake up so you remain hydrated. Avoid red liquids, milk, creamer, alcohol, juice with pulp, and anything you cannot see through. Mix the bowel preparation according to the instructions on the container. Prepare it the evening before your colonoscopy and refrigerate it before drinking. You may use the flavor packet that comes with the preparation. Do not add sugar, ice, or any other flavoring directly into the container. At 6 o'clock p.m. the evening before your colonoscopy, begin the first half of your preparation. Drink one 8-ounce glass every 10 minutes. Continue until you have finished 8 glasses. Stay close to a bathroom. The preparation will cause frequent watery bowel movements. You may continue drinking clear liquids until midnight. If you become nauseated, slow down or briefly pause. Resume the preparation at a slower pace once the nausea improves. Begin the second half of the preparation 4.5 hours before your scheduled colonoscopy time. Again, drink one 8-ounce glass every 10 minutes for a total of 8 glasses. 15 minutes after finishing the preparation, drink one 8-ounce glass of clear liquid every 15 minutes or a total of 2 glasses. You may continue drinking clear liquids until 3 hours before your examination unless your procedure center gives you a different instruction. Some important reminders: do not eat solid food during the preparation. Do not stop the prep just because you have started having bowel movements. Stay hydrated with approved clear liquids. Use petroleum jelly or a barrier cream around the anal area if frequent bowel movements cause irritation. Call DigestWell Health if you have severe abdominal pain, repeated vomiting, cannot keep the preparation down, or are unsure how to proceed. Remember, no solid food, no dairy, no pulp, no red or purple, and follow your instructions. Doing this correctly helps your doctor get the best possible view during your colonoscopy. Next, we'll cover how to know if your bowel prep is working properly before your procedure. If you're unsure about anything, call your DigestWell Health team before your procedure day. At first, your bowel movements may be brown and contain solid material. They should gradually become watery, lighter in color, and eventually clear or pale yellow. By the end of the preparation, the liquid should look similar to urine and should not contain solid pieces. Even if your bowel movements look clear early, finish the entire preparation unless your doctor tells you otherwise. For patients taking insulin, diabetes medications, or blood thinners, our team will actually contact you and guide you during the whole process. Bring an updated medication list with you. You must also have a responsible adult present at check-in who remains in the endoscopy area and drives you home after sedation. Without an appropriate driver, the procedure may be canceled. Remember, clear liquids only the day before your procedure. Start part 1 at 6 o'clock p.m. Start part 2 4.5 hours before your colonoscopy. Finish the entire bowel preparation and stop drinking at the time listed in your written instruction sheet. A properly cleaned colon gives your doctor the best opportunity to find and remove small polyps. For questions, call DigestWell Health at 614-547-2270 before your procedure day.